Hello everyone, congratulations for your IVF pregnancy. Your patience and efforts involved in IVF have paid off and the new journey has just begun. Myself, Dr. Shikha Sardana from Obs-Gynae Department, Chaitanya Hospital, Chandigarh. In our drive to support the health of moms and babies, we are again here today. The question that we will address today is regarding IVF pregnancies. How is an IVF pregnancy different from a natural one? IVF, the unique technique of making babies in lab, is gaining popularity, and with improved success rates, more and more women are now experiencing the IVF pregnancies. And likewise, we doctors now find that a significant chunk of our obstetric population are pregnant patients that we are managing are IVF conceived ones. But still, it is not surprising when we find IVF conceived women anxious to know if their pregnancy would be a normal pregnancy or a high risk one because they conceived their baby in a lab. With all our experience over the time, we are here to answer you. We understand that a woman with IVF pregnancy is under a lot of stress during the IVF procedure, taking daily hormonal injections, daily medicines, visiting doctors, and hoping desperately for the positive result. This is like a norm in all IVF pregnancies. But now, as you are pregnant, it's the time to leave all your stress behind and enjoy your pregnancy. IVF pregnancy is just like any other pregnancy, but yes, it needs somewhat more medical support in the initial 3 months. After the 3 months, IVF pregnancy is just like a natural pregnancy. You don't need even any extra medications. In fact, the need for bed rest is also a myth. It's the most common myth that prevails about IVF that strict bed rest would be required for all 9 months. Actually, there is no added advantage of taking strict bed rest after conceiving by IVF. You only need to avoid strenuous activities. The roller coaster ride of IVF pregnancy is no different than natural pregnancy. The minor differences, if any, are not because of IVF per se, it's because of the pre-existing health conditions, the baseline health conditions in which you have got your IVF done, or because of the baseline health conditions, the basic indications for which the IVF was done. See, let's take up the problem of miscarriage. The problem of miscarriage is slightly higher in women with IVF pregnancies. But this is probably related to the fact that age of women getting IVF done is more, and with advanced age or otherwise as such, they are more likely to have some medical conditions like diabetes, hypertension, obesity, hormonal disorders. Then there can be fibroids or other uterine anomalies. All these contribute to slightly higher risk of miscarriage in IVF pregnancies. That is why we support the IVF pregnancy with extra medications in the initial 3 months. Then the other contributing factor is higher incidence of aneuploid or chromosomally abnormal embryos in humans as such. Then coming to multiple pregnancies and IVF. Multiple pregnancies like twins, triplets are always high risk because of increased chances of preterm delivery and low birth weight. These twins or triplets can happen in IVF when more than one embryo is placed in your uterus to increase the chances of pregnancy, but IVF per se does not add on to the risk. The risk associated with the condition is just like the risk with naturally conceived twins. Then coming to abnormalities in the IVF babies. Yes, again, this is one of the biggest doubts with IVF, whether the IVF baby would be a normal one as they are artificially created in the lab. So here we want to tell you that IVF procedure does not lead to congenital abnormalities in the babies. It is basically infertility per se that increases the rate of anomalies. The rate of anomalies are same in infertile population whether conceived spontaneously or by IVF. Factors like advanced age, obesity, etc., they contribute to the risk. Women with IVF pregnancies are continually under strict supervision to confirm the normalcy of babies by various tests like blood screenings, targeted ultrasounds for fetal anomalies, and echo study for heart. All these confirm the normalcy of the babies, and these tests are quite reassuring. Then coming to mode of delivery. IVF pregnancies can deliver vaginally if you don't have any high risk factor. In fact, we encourage you to go for antenatal exercises to increase the chance of normal delivery. Regarding the higher incidence of cesarean section in IVF pregnancy, the reason is once again due to the associated high risk factors that we have discussed before. So I hope now you must be able to understand that IVF per se does not make your pregnancy high risk. But yes, it makes your pregnancy a special and precious one requiring more care. If you have any query, you can ask us. Once again, congratulations, the dream has come true. There is a new life growing inside you. Now enjoy this beautiful phase with the wishes for a happy and healthy pregnancy. We thank you all for joining us.